or two. Give more folks a chance to join. Thank you very much. So thank you very much, everybody, for joining to listen and participate in this round of community conversations. And we are quite pleased to have experts here today, healthcare experts, to address our concerns and questions about COVID-19. And with that, I am happy to hand it off to our mayor, Mayor Ggary. Mayor Ggary, you can start the conversation. Thanks very much.
Thank you, Vice Mayor Jordan, for your help. And again, welcome. Thank you so much for joining us in our first round of community conversations. I am so excited for these panelists of experts that are willing to come to our community and educate us. As you know, we're reopening our businesses. We're also trying to reopening our schools. And so I thought it was important for all of us to engage in conversation on what best practices are. Now, mind you, the doctors cannot speak specifically to issues that concern our city or concerns, but in general, they can talk about things that are affecting our community, our state, and on another level, they'll be able to talk about what they do as physicians, their research. We'll go into more about dismantling myths. We'll talk a little bit about how isolation, depression, children trying to navigate through the pandemic. And so without further ado, I'm going to go ahead and allow the physicians to introduce themselves and tell you a little bit about their background before we begin the conversations. Dr. Cherry?
Hi, and would you like me to start my video also or no video?
You can turn on your video. Thank you.
Hi, everyone. My name is Arthi Chari. I'm one of the infectious diseases physicians. I'm a physician at the VA Palo Alto healthcare system and Stanford University infectious diseases section. I see adult patients. I'm a clinician. And so in the past year, I've also become the de facto COVID expert at our facility, I think from an infectious disease standpoint. My interests are in HIV and general infectious diseases. And again, I think this we've learned so much in the past year. There's an incredible amount of data coming out at an incredible speed. And we've all had to become somewhat of experts fairly quickly using our backgrounds, our various backgrounds and areas of expertise. So currently I see patients at my hospital, and I'm involved in a lot of the policy regarding COVID-19 with regards to isolation, quarantine, what advice we give our patients, what advice we give providers, infection control measures, and general care of people with COVID-19. Thanks.
Thank you, Dr. Cherry. And I'll go over to Dr. Bloomberg.
Yeah, and I apologize for my video going out just a moment ago. Every once in a while it does that on these Zoom calls. It just randomly stops. So I just need to unplug it and plug it back in. But I'm a pediatric and infectious diseases specialist at UC Davis Children's Hospital. And I also work at other area hospitals at Sutter and at Shriners Hospital also. And like Dr. Cherry, I'm involved in a lot of the policy work related to COVID, as we all have been, in terms of isolation of children, treatment of children, and the diagnostic tests. And we're all involved in trying to prevent transmission because we realize, in my case, it's really important. We want children back in school. We want them to stay healthy, and we want families to stay healthy also.
All right, thank you, Dr. Blumberg. And Dr. Cooper.
Hi, everyone. I'm Dr. Michael Cooper. I'm originally from the Midwest, and then went to New York for med school and stayed on there for residency. And then my wife and I, after spending about a decade living in Brooklyn, we moved to the Bay Area January 2020, just a few months before the start of the pandemic. So it hasn't been quite the California experience we thought we'd have, but we're adjusting and learning to make the most of it. And currently I'm a consultant psychiatrist for Alameda Health System, where I see families across a range of settings. I see patients in several primary care clinics on an outpatient basis. I also cover inpatient consults at San Leandro Hospital and Alameda Hospital, as well as at several of the nursing homes in the East Bay. And they also spend some time on the weekends working at John George Psychiatric Hospital. So I'm fortunate to see patients through a wide range of treatment settings. And it's been pretty eye-opening seeing the uptick in depression, anxiety, and responses to COVID-19 on people's mental health in all different areas of the community, and then in these different treatment settings as well. So it's been helpful to really see sort of a holistic perspective as far as the kind of treatment people are seeking in these various settings and how we can best help them. So I'm excited to talk to everyone today about my experiences and share some stories from my patients as well. Thank you.
All right, well, thank you, Dr. Cherry, Dr. Blumberg, and Dr. Cooper. Please note that Dr. Grace Lee, she had a prior engagement, and she will be joining us around 5:15 or so. And once she jumps on, we'll just continue the conversation, have her introduce herself, and go from there. All right. Well, with no further ado, please, just one more housekeeping thing. We are doing questions and answers. I would ask that you would put your questions in Q&A. And at the end of the conversations with the physicians, we will open up and address as many questions as we can. Please note this event is supposed to end around 6:30, but we will try our best to get to as many questions as we can. And with that said, we're going to start off with Dr. Cherry. Dr. Cherry, you talk about infection diseases. And we know that the new variants are out, but go and elaborate more about the transmittal in adults and what you've seen. Talk a little bit more about your research and how it's benefit and help just discover what we need to learn more about the virus.
Great. And you can also let me know, Mayor Gary, I have a couple of slides just to show people kind of what's been happening with the virus. I don't know if is it okay to show a couple just slides as I talk?
Yes, it is.
Points. Again, we've been really immersed in this in the past year, and over that year, I think that many hospitals have been involved in research studies, both in treatment. It's really been this huge effort, I think, across the world, which is what's led to actually this really rapid development of vaccines, which we can talk about a little bit more. But everyone has really been involved in not only kind of understanding what's going on at their hospitals, but also in their communities, and through studies involving, again, clinical kind of treatment type of things and testing. It's where we've gotten lots of data in the past year. What we, our hospital specifically has been involved in both what we call epidemiologic studies, so looking at trends and patterns among people who are at risk for COVID, and also people that have COVID, as well as treatment studies, looking at various treatments for COVID-19, and have been involved in, and I've been involved in some of the studies that have led to approval of remdesivir, for example, which is the only currently FDA-approved drug for treatment of COVID-19, although there are many other investigational drugs that have gotten preliminary or EUA approval. I'd like to talk a little bit about kind of what's going on right now with COVID and what trends we're seeing. because this changes frequently. I think it's really important to understand, as the mayor was saying, what we know about how transmission occurs has evolved over the past year, because it really has. I mean, if you look back, 8 months or a year ago, all of us were pretty fearful of doing many things and unsure of what would transmit virus. And now we have a lot better understanding of that. And I think you can see that understanding actually if you take a look at what's been happening with the epidemic in our country. And so I did want to show kind of briefly just what's the current status of COVID-19. And essentially it's something that's really favorable. So what we're seeing, and please let me know if you can't see this table, this slide that's right here. But what we're seeing in the past 4 or 5 weeks is that laboratory confirmed COVID-19 infections and also hospitalizations is down significantly in the past 4 or 5 weeks, kind of at a remarkable rate of decline, which is great news. What this probably means, and I'll also show you what's going on in California. As you can see here, rates really skyrocketed compared to even July. When July we thought it was bad, but then November, December came around, and it was probably due to gatherings, the weather, indoor gatherings, and holidays. But the rates really skyrocketed of both hospitalizations, ICU admissions, and just overall COVID-19 cases. As you can see here, again, in July, we thought it was pretty high in July, but then in November, December, it was off the charts. I think through a combination of really aggressive public health measures and personal behavior choices that people were making, as well as the end of the holidays, the rates have come down. That's the overall thought, is that's why the rates have come down so much, is that, again, a lot of places have implemented some pretty strict public health measures, and people are being really careful appropriately out of concern that there were really almost no ICU beds available in many areas of California in parts of December and January. So this is overall a great trend that we're seeing. And as if you guys can see here, Alameda County is right about here. So not one of the top counties as far as rates of coronavirus, but among the top maybe 15. But what this means is, again, we know what to do to decrease COVID infection and transmission, and we can talk about that a little more. But we know what to do as a community. We know what to do in public health at this point. And we have shown that we can bring down rates by doing the right thing when it comes to public health measures and personal behavior choices. And again, we know that we can have some pretty serious impact on these very serious outcomes like hospitalizations and ICU admissions, where again, they've been brought down significantly in the past few weeks. Alameda County is currently still in the purple tier, as are really most counties in the state, and that's due to this adjusted cases per day of 9.5 per 100,000. To get to the next tier, we have to get down below 8% approximately. And yeah, this is just kind of that decoding of, we hear about these purple, red, orange tiers a lot, but this is just kind of what it means. And again, Alameda County and as well as the rest of the state have shown that there too, the rates have really declined from being in the thousands, in the kind of 1,000 range per day in parts of January, to now being down to 100 or 200 per day. So again, really our choices have led to this decrease, and we've shown that we can do it. So what things are risky and what things are not? In general, I think the short answer is things outdoors and with your household are not risky or less risky, and things with people outside of your household and indoors are more risky. And that's the kind of easy summary of what's risky and what's not. This is a kind of a nice table that shows some things that are from less risky at the top to more risky at the bottom. Doing outdoor sports where you're kind of just one-on-one, they give an example of playing tennis, where you're far apart is an example of something that is not risky. Opening your mail and opening packages, this is something that we were all, I think that there was understandable, real anxiety about early on. We got these studies that COVID could be on packages or on cardboard for a long period of time. So everyone was understandably very worried about getting COVID from packages or deliveries or mail. Now we've found out that the majority of COVID-19 transmissions really occur because of droplets in the air, inhaling droplets in the air, not so much by contact, meaning touching those droplets and then infecting yourself. Now that can happen, but it's a lot less likely to happen than actually getting it from direct breathing or having someone that is infected cough, talk, sing, breathe near you, particularly without masking. Things like packages are not so risky because it requires a lot of things to happen for us to get infected by a package. The person that delivers it has to be infected. They have to be getting infectious droplets on the package. Those droplets have to remain there. You have to touch the droplets. You have to get enough on your fingers to cause infection, and you'd have to get it into your mouth or nose or eyes. So that combination of things makes it incredibly unlikely. That said, I think the CDC generally recommends that when you are touching things outdoors or in public areas or even packages, it's reasonable to wash your hands. It's appropriate, and you should wash your hands afterwards with soap and water. The same thing is true of groceries. This is another thing where we were very concerned about groceries and bringing in groceries from the store. I know my family members certainly kind of used all kinds of cleaning solutions on their groceries. And I have to admit, for a while I did too. And now we also know, again, in a similar way that packages are low risk. Groceries, bringing home your groceries is incredibly unlikely you're incredibly unlikely to get infected from your groceries or from droplets on your groceries. Again, it's always reasonable to wash your hands after handling packages, groceries, after going to the store, after going to any kind of public place, washing your hands, and also washing your hands before and after eating is always a good practice to have no matter what. In general, the CDC doesn't recommend any additional or heightened cleaning of your food or food packages, aside from what's already recommended for things like fruits and vegetables, which is a good washing of fruits and vegetables prior to eating. And again, always washing your hands before and after eating. Other things like eating in a restaurant outside, again, there was a lot of concern about potentially getting this from food. Really, this is not borne out at all. I think this is another thing where I can very confidently reassure you that you are not going to get COVID from food or food preparation or from the food you get from a restaurant, for example, by takeout or even eating outdoors at a restaurant. So that's also incredibly unlikely, and there have been no transmissions documented or shown from that. This table of kind of what else is risky and not are things that we can generally predict. So again, in well-ventilated areas indoors is better than being in poorly ventilated areas indoors. Being outdoors is even better, and being outdoors kind of separated by 6 feet from people that are not in your household is even better. The general things that might be more risky are, again, things that are indoors. There have been some transmissions at gyms at other counties, in other countries. So I think they're really cracking down on indoor gymnasium type of or fitness studio kind of places. Attending any kind of large event where people are crowded, whether it's indoors or outdoors, honestly. Attending, indoor restaurants and bars at this point, because the key thing about indoor dining is that the community rates need to be really low because it involves people taking off their masks, potentially in close proximity to each other, and also maybe in areas that aren't very well ventilated because that's just not the infrastructure of some restaurants. So I think that's why in California here, it's still, outdoor dining. And I feel that in outdoor dining settings where they have seating that's set 6 feet apart, which I think most of our outdoor dining areas have, they're going about it really well. It is safe to eat outdoors. It is recommended to do this with members of your own family. And if you're going to be with people outside of your own family, to sit separate from them, or at least 6 feet from them. Because again, you're going to be taking off your mask to eat and drink. It's also recommended to only take off your mask to eat and drink when you're in those outdoor dining situations, and replace it when you're not eating or drinking.
So Dr. I want to jump in and I would like you to elaborate on something. So we are a very active community, and I know looks like you're going in that direction. One of the questions I would like to ask you, running, cycling, not having a mask on, when you're around people that are also walking in their mask, but you see a runner without a mask on, or a bicyclist, talk a little bit more about that, because you're talking about droplets, sweat running often. How does that play a factor into transmitting the virus as well?
Right. Yeah, so that's a great question, because again, there was another. I think that the thing we have to translate is that there's a lot of research that comes out. I mean, there's been thousands and thousands of papers that have come out, and each time, sometimes some of them kind of tend to grab a headline, and the headline, we just have to remember, doesn't tell the whole story. It doesn't necessarily apply to us. So, for example, if they say that they can, they can have a runner and they can detect respiratory droplets, 20 feet behind them, that does not necessarily mean you're going to get COVID if that person has COVID. It requires more things to be happening. It requires a combination of things to be happening. So in general, outdoor exercise is safe, again, ideally when you are separated from other people. I think that, again, I bike to work, for example, and I keep a mask around I keep a mask that's pretty breathable around my neck, so that I can put it on whenever I pass by people. I think it's generally actually out of courtesy, because I know that I don't have a perfect understanding of how COVID is transmitted. I don't think anyone can claim to. I think it's probably low risk that you running by somebody or biking by somebody is likely to expose you to enough droplets from somebody else's respiratory tract to cause infection. So overall, I think that's pretty low. That said, I think out of courtesy to our other community members, it's highly recommended. I would definitely recommend it, actually, to take with you a mask. And if you're in an area where there's no one else around you, you don't need to wear it. But if you're having to kind of run right beside somebody or pass by somebody, it's courtesy to put your mask on. Again, this is not a definite answer. I don't think that there is a definite answer to this, but and I welcome the recommendations of other panelists as well. But I think that's kind of there's a mixture of I think science and being a good citizen that is involved in this past year. We don't know all the answers. Again, I think it's low risk, but I still recommend taking a mask with you so you can put it on when you're near other people, certainly when you're within 6 feet of other people, and they can't choose to go around you or something like that. Because again, it's just part of being, I think, a good citizen. I do think that the overall being outdoors and exercising outdoors is a safe activity particularly when you're on your own. Again, contact sports, things like that, that's a slightly different story. And maybe Dr. Blumberg talked about maybe there's more discussion about children and sports. But I think that overall outdoor activities on your own, like running, biking, are safe. Tennis, are safe for other people. And you cannot transmit COVID from sweat, or at least it'd be incredibly, I think I'm willing to say it'd be impossible. So I think that that's not a concern, sweat kind of evaporating off your body or getting onto somebody else. It's really the respiratory droplets. And so again, you'd have to infer that that person would have to be COVID positive and would have to have enough droplets. And the thing with being outside, the reason why outside matters is that there's always ventilation. There's infinite ventilation outside, essentially, in places at least, when you're not in a tent, for example. So outdoors, most of what you're breathing out will instantly kind of dissipate into the air and become so unconcentrated. Whatever's kind of concentrated coming out of your mouth really dissipates and into the air around you. So I think that's basically the reason why outdoor activities like that are safe. So again, the CDC kind of outlines that running, walking, biking in your neighborhood park is safe. Outdoor yoga class, working in a garden, working even in a community garden if there are people really separate from each other. Taking your dog for a walk around the neighborhood, hiking on trails. Again, that's kind of subject to how crowded they are. Things that are less safe are, again, anything basically indoors. Fitness center, malls, yoga studios, other studios. indoor pools and even outdoor pools. And again, you have to be very careful because of crowding and bathrooms and things like that. Going to restaurants, we talked about this a little bit, but very safe, picking up curbside meals, getting food delivered, eating outside at a restaurant where they've implemented safe measures. If they have things like tents, make sure they're well ventilated, like not closed in, at least one side is open. Wear a mask except when you're eating or drinking. Wash your hands before eating and when leaving the restaurant as well. Ideally ask for individual condiments and salt and pepper packets and things like that, because those things might be commonly used things that are touched by lots of people and sit apart from people you don't live with. And again, for right now, at least we're recommending eating inside a restaurant is a less safe activity. Other outdoor activities, again, felt to be safer, having a picnic, sitting apart from other people. Again, other activities where you're really not coming close to each other, contact sports, for example. And again, this is some other, entertainment-wise, not recommended to be doing indoor activities right now, but outdoor activities like outdoor movies or something like that might be okay. Any other questions, Mayor, about just transmission, that you wanted me to address?
No, I think you covered those topics very well. But I know when we had our one-on-one prior to the meeting, you talked about the how we wear our masks. We're getting double masks, one mask, tight-fitted mask. Can you just go a little bit into detail on what's the guidelines for us masking, how tight, how fit, and just provide some type of information on that as well?
Yeah. So the bottom line is wear a mask. Just please wear a mask. We know that even imperfect masking can do a lot. It can actually filter a lot. Again, up to like 50%, 50, 60% even, with even a mask that is maybe not even a perfect fit, but just covers the droplets from coming out of your mouth when you're speaking or breathing. So just when you're around other people outside of your household, or when someone is from outside your household is in your house or indoors with you, or you're within 6 feet of somebody outside, wear a mask. Recently, there's been a lot of discussion about this, about fit and how important is fit. And essentially, at this point, the CDC is also recommending, okay, we're all, hopefully, most of us are wearing masks now. I think in California, it's been the norm to wear a mask now and accepted. But what we do see, I see this a lot, is a lot of times it's difficult to get a mask that fits right. And everyone's face is very different. And so I see a lot of people with masks that are kind of falling around their nose. Certainly a mask doesn't really work if it's not around your nose and mouth. The cloth masks in particular that are one layer seem to do not as great of a job, of filtering out particles compared to a 2-layer mask, for example, either a cloth or other mask that has at least 2 layers. So the CDC recently did a study with dummies, not with real people, but with these mannequins, and found that when you used 2 masks, double masking, you could potentially improve the amount that was filtered out from a person that was near you. So let's pretend like this dummy has this mannequin has COVID. Then wearing a single mask like the one on the left, where there's a lot of gapping, and actually I have one of those here. As you can see, when I wear this mask, there's a lot of gapping around the sides here. It does not fit me very well. Even when I try to pull it down, it doesn't really fit very well. The gapping is seen right here. I feel like this mask would do an adequate job of maybe protecting other people from my droplets to some extent, but probably not protecting me a whole lot, maybe. Again, better than nothing. To try to fix this, the CDC recommends doing something like this, which is tying a knot right here and tucking in.
Dr. Cherry, I hate to interrupt.
Yes.
This is Vice Mayor Jordan.
Yes.
Thinking maybe if you could stop sharing your screen, then people will be able to see.
Sure. Of course.
Instructions you're giving, which we really appreciate. Thank you for doing that.
Is that better? Did I do?
Yes.
Okay, great. So, so tying it right here, and then tucking the ends of this, kind of like this, so that this will fit a little easier. Now, again, this is not perfect for me either. but it does a better job of fitting on my face than the other one did. It's tucked, these ends are tucked in more here. And then now I can feel that it's flush against my face here. And it fits better on my nose when I do the same thing, when I do that. And again, I pull this all the way down here, and now I feel like I actually have a fairly good seal all around here. And this does a better job at filtering. The other things people can do are at least, make sure that their ear loops are tied, snugly, because if they're very loose, it won't fit snugly around your face. And even better, particularly for children, are the types that tie behind your head. Those have been found to have maybe a tighter fit than the ones that tie behind the ears. So again, I think those are some potential ways where you can make one mask fit better. And they found that actually, again, because a lot of people have cloth masks that don't necessarily fit that well, that using a mask like this that maybe doesn't fit so well, but then putting another mask over it can make the fit more snug. And that's really, I think, what's more important. There, I think the message that got out was CDC is recommending everyone double mask. And actually, we had us in the ID world actually message the authors of that paper, and they actually wrote back and said, no, this is actually not the message. The message is that fit of the mask is important. Getting a good fit is important. We're not recommending double masking, but if double masking is what might help you get a better fit with the mask that you have available to you, then do double mask. Again, assuming that it's still breathable, you can still breathe with it, and you can wear it. Again, another important thing is really that you're able to tolerate it and not that you're constantly pulling it off or taking it off because it's so uncomfortable. So I think those are kind of the take-home points that I would say with the masking, is that make sure it fits. Try to optimize the fit as much as possible by one of these methods, either covering it with another, using a kind of a procedure mask or one of those the mask that I just showed you, and putting a cloth mask over it, or trying to take that mask and make it fit a little bit better on those procedure masks and not the ear loops, and tuck the sides.
So Dr. Cherry, I'm going to go ahead and take a break. Thank you so much. We will have additional questions when it comes to masking or whatever the audience has as far as learning more about the infectious disease. I'm going to move to Dr. Blumberg. And Dr. Blumberg, in your expertise, especially working with children, we have these 3 different new variants that have come out. Can you speak a little bit more to that and how we can protect our children, and just something that you've seen over the past, I would say 3 months, what has changed and what will help parents really understand more about what is needed to protect our adults as well and children?
Yeah, so many people have heard about the new variants. They're all different. And so the new variant, so the UK variant, for example, that one appears to be about 50% more infectious compared to previously circulating strains. And so that's obviously a concern. The good news is that it appears that previous infection or vaccine-induced immunity will still protect against the UK strain. The South African and Brazilian strains are similar to the UK strain in that they're likely more infectious. They have very similar mutations, but they also may be better at escaping vaccine-induced immunity. And so that's something that we're still working out with our currently available vaccines. And some of the vaccine manufacturers are already looking to update their vaccines with those variants. And then people may have heard about the California variant, and that seems to be pretty similar to the UK variant in that it appears like it might be more infectious. So clearly this poses a danger that right when we're getting control of the virus, as Dr. Cherry mentioned, with decreased number of cases, that these variants could result in another surge if they take hold. And in fact, the CDC has, they've estimated that models show that the UK variant will probably be the dominant variant in the US sometime in the middle of March. To me, the message from these variants is that we need to do what Dr. Cherry was just talking about, which is we know there's scientific evidence that masks work. They prevent infection, and we've got scientific evidence that social distancing works. So these are the 2 primary things that people can do to prevent transmission to themselves, within their families, and within their communities. and that the vast majority of transmission does take place indoors. 90% of transmission takes place indoors, and that's why being outdoors and diluting the virus in the air outdoors is anything outdoors is safer than indoors. So in terms of children, we know that illness is much milder in children compared to adults, that the vast majority of deaths and severe hospitalizations are in adults, but children may end up in the hospital. They may end up in the ICU. I've seen children on ventilators in the ICU with bad COVID pneumonia. And then people may have heard of the MIS-C, the multisystem inflammatory syndrome in children, that follows about 3 to 4 weeks after children get COVID. They have this hyperinflammatory state with fever, rash, and then many different organ systems involved, and they can be very sick and in the ICU. And fortunately, we do have treatments for this, but the children may suffer long-term consequences from that. So that's why it's incumbent upon us all to prevent infection among all populations. I think one of the main things we're concerned about is the toll that this has taken on families, and specifically on children in schools. Schools are so important. I think we just realized so much how much more, even more, we value our teachers and our schools and how important they are for children. Distance learning does not work for everybody. We do feel that there's some evidence that we are getting evidence that it is safe to open schools, that children are not the primary drivers of this pandemic. And there are ways to open schools safely that do not result in increased rates of transmission within communities, and also that are safe for teachers and staff. So again, it's more serious in teachers and staff and older individuals and adults. But the studies are showing that when schools do reopen, if there is social distancing, if there is masking in place, that the vast majority, that there's very little transmission in schools in the first place, but there's very little transmission from children to adults. Almost all the transmission is child to child. And then there's a little adult to adult transmission also if the adults aren't masking and following the social distancing advice. So we think with masking, with social distancing, with adequate testing, and contact tracing in case there is a case in a school so that you can limit transmission, we do think that it is safe for schools to consider reopening, even when the counties are in these tiers where there's a lot of transmission within the community.
Thank you, Dr. Bloomberg, on your explanation on that. We'll move to Dr. Cooper, because you brought up an excellent point, Dr. Bloomberg, about the impact that it's had on families and especially children as they've been able to social distance learning and grabs, trying to get an understanding of what's next. So Dr. Cooper, would you please, if you could talk a little bit about what you've noticed over the past couple of months, what you've seen in your patients and how you've been able to help families kind of get past this fear. And that's the thing, we have to decrease the fear that has been placed out into our community. So if you can talk a little bit about that, and then again, we'll just continue to engage in conversation as Dr. Lee comes on as well.
Yeah, thank you. Great questions about how do we deal with fear and anxiety in this period of time where it seems like there's a never-ending amount of things to be fearful about. With new strains coming out after we seem to get a hold of on top of the vaccine or on top of the virus with vaccines, and another strain emerges. Like, how do we deal with this perpetual sense of anxiety? And I think that's really where good mental health treatment comes into play. And I do want to talk a little bit about that here in my presentation. So first, I do want to share some disheartening statistics about the state of mental health in the age of COVID. And then I'm going to go in and talk a little bit more about why we can have hope for the future, things we can do with our families, with our friends, loved ones to combat mental health issues that are rising in the age of COVID. So just a few statistics I think are really important to think about in our discussion. So the CDC reports that from March to October of last year, the share of mental health related ER visits rose 24% for children ages 5 to 11 and 31% among adolescents ages 12 to 17 when compared to the same period in 2019. In a survey by the mental health charity Young Minds, which included 2,100 participants up to age 25 with a mental illness history in the UK, 83% said the pandemic had made their conditions worse. 26% said they were unable to access mental health support. In a recent Gallup poll of parents, nearly 30% say their child is already experiencing harm to their emotional or mental health because of social distancing and closures. Another 14% indicate their children are approaching their limits, saying they could only continue social distancing a few more weeks until their mental health suffers. And one more statistic, a recent study has evaluated 1,000 quarantined children and adolescents in China in an age range from 6 up to 15 years. And a third developed depression, anxiety, or both. And many of these children also develop symptoms of inattention, clinging, worry, and irritability. So I think this goes to show that having so much quarantine going on and so many children involved in remote learning, it's really impacting their mental health and well-being. So I think thinking more seriously about how we can open schools safely, get children back into the classroom, create a broader space for both parents and children to experience life again, I think is crucial to everyone's well-being. I do want to share now a few, at least one or two stories from my patients, several of whom are parents, stay-at-home moms, fathers who are working, and how the pandemic has affected their mental well-being as well as their children's well-being. So the first story I want to share is from a couple in their early 40s who are both working full-time, and they have two children ages 6 and 7. And this is from the mom's perspective. This past year has been challenging in many ways, not only for the kids, but coordinating childcare. Our kids were anxious about their grandparents getting COVID and dying from it. So they would send messages asking them to stay at home, wear a mask, etc. They asked questions like, is grandma going to die from COVID? And they needed constant reassurance from us. Online schooling seems less involved, lacks structure, and has fewer interactions. For example, only a handful of kids who are very outgoing are observed to be answering questions all the time, whereas the quieter students who need more encouragement to speak up seem to be missing out on group discussions. The biggest impact has been on socialization and peer activities, which is a big part of child development at this early stage. They miss seeing their friends at lunch, playing basketball or soccer. We tried a couple of virtual play dates, but it was no good. They use iPad for games, videos, and TV. So although my husband and I were not happy with the increased screen time, we didn't have a choice, as sadly we didn't have anything better to offer. In the past few months, the closing and reopening of schools has led to a disruption of schedules, as each time they shift to online or in-person schooling, they have different schedules and different start and end times. Although they are slowly getting used to it and able to go back and forth more easily. So another couple who have a daughter age 7, they've also been struggling with remote learning. Here's a couple quotes that they sent me. Remote learning has brought a whole other set of challenges to my wife and me. It's definitely taken quite a toll on my wife to have to be with her daughter several hours a day teaching her. It's been a financial strain as my wife hasn't been able to work and brought us down to one income, and she's also been emotionally exhausted. I've heard my wife say on a number of occasions that she's felt like she's losing her own personal identity in this, as she's been so wrapped up in making sure her daughter is getting what she needs. On a positive note, he did say this to me. With all this said, the time together with the three of us has really created a strong bond. We spent a lot of time playing games, board games, card games, and also video games. I've been teaching our daughter about music, and my wife has been showing her a lot of domestic tasks around the house, which is something that isn't taught in schools anymore. Our daughter has taken to making big plans for when the pandemic is over and we can travel again. We really encourage her to not stop dreaming, keep planning for the future, and encouraging her imagination. Quiet time, reading, and meditation has helped us hang in there and forget about the madness of the outside world. So those are a couple of anecdotes that were shared to me by a couple of my patients. And I do want to say a few things about my own personal experience as a psychiatrist working in this pandemic. So again, I think a lot of the anxieties have come from just feeling somewhat enclosed with this lack of physical and psychological space, with so much of us staying indoors and having a quarantine, working from home more than usual. So my wife and I have been working from home for the majority of time during the pandemic. And it's a strange feeling for me to disconnect from Zoom after speaking with a patient. And instead of leaving the office or hospital, I leave our bedroom. Suddenly I'm back in our living room. My brain still feels like it should be at the hospital. So it's taken a lot of effort for me to create rituals around maintaining separation from my work and home life. For example, the past couple of months, I've been trying to design a virtual commute that mirrors the commute I used to have driving or taking the train 20 minutes to and from work. So now after I exit Zoom, I put on my headphones, turn on some jazz music, and read a book for 20 minutes. If my wife wants to speak to me during this time, I say something like, "Sorry, honey, I can't hear you. I'm commuting right now." Then we will sit down after this and after my virtual commute is over, and then I can give her my full attention. And this has been working out okay. Also, rituals like changing out of my work clothes, whether that's a button-down shirt or scrubs, into a t-shirt and jeans after working, also helps create psychological space that I need between my work and home life. We both also started seeing therapists, which has really helped with managing the anxiety we've experienced at the start of the pandemic. Therapy helps create a protected time each week that we have to speak to someone other than one another or our work colleagues and friends. And therapists are wonderful because they are not only extremely skilled at listening to us talk at length about our problems and neuroses, but they also offer helpful insight and perspectives that we wouldn't otherwise have.
So thank you, Dr. Cooper, for sharing. And it's so vital right now, just dealing with the emotional aspect of it. And so as we continue the conversation, we will come back to you, but I'll have Dr. Cherry and Dr. Bloomberg, if they will share their video and jump in. And I see that Dr. Grace Lee has joined us. Welcome, Dr. Lee.
Thank you for having me.
And so, Dr. Cherry, one question was brought up when you were talking about transmittal. The concern has been about travel. Now, we've heard that we're not supposed to travel, that we're supposed to stay in place, limit our travel on airplanes. Can you talk a little bit more about that, the importance of it, or is it just, just another safeguard on how we keep everything in our specific cities and our homes? You're on mute.
Sorry. I was just listening to a webcast from the director of the CDC, and she again reiterated, don't travel. I think that we just should not be traveling. And there are multiple reasons for this. I think one is, I think that, on a case-by-case basis, there are still some situations where you could do a kind of a day trip to the beach or to the park or to something like that, and that's okay. Other situations, again, this is all, everyone has to make their own judgments, but there are some situations in travel, or many, where you tend to not have much choice about being around other people. For example, air travel, actually plane travel on its own is not necessarily so risky, but there are a lot of situations where you have no choice. You have no choice about whether you're sitting right beside somebody who could be coughing or not wearing their mask well. You have no choice about being in these kind of crowded situations, potentially in airports or in other settings. So, and then the other thing is, again, when they look at the variants, transmission of variants, when the CDC looked at, for example, in some of the first cases of the B117, the UK variant, essentially everyone had traveled outside of the country, and a few of them had traveled, this is in the Midwest, had traveled to California and had just got back from California travel. So we know that this kind of travel between states and to other countries makes us more likely to be able to acquire and transmit COVID by being around other people, and even variants that might not currently be in our area. So I think that for right now, it's recommended still not to travel.
All right, thank you, Dr. Cherry. Dr. Greenberg, and as you see patients come in, what are some symptoms or concerns that parents are asking you when it comes to, do my child have the flu or do they have COVID? Can you speak in great detail to that?
Yeah, so one byproduct of this is that with everybody masking and social distancing, we've had historically low rates of influenza, as well as other respiratory viruses such as adenovirus or respiratory syncytial virus, RSV. So that's a real benefit. At our medical center, we haven't had one positive test for influenza this year. So, which has really been great because we don't need any more pressure on the healthcare system with influenza. And so this has been seen in other communities and in other countries also, that the masking and social distancing prevents others. But, you know, it is difficult to know when to take your kid or when to go to the hospital or your healthcare provider yourself. You know, anybody who is having difficulty breathing, really, you should seek medical attention. And anybody who has a high fever, many times people aren't feeling well and they're prone to getting dehydrated. And so if they're not able to hydrate well and they might need an intravenous fluids, they should see their medical provider. Those are the kind of things I really worry about. And if they're not getting better. But the influenza and COVID can be very similar with fever and respiratory symptoms. In children, they tend to have more stomach aches with influenza compared to COVID. Now that we're getting closer to spring, the question is also going to come up is how do you differentiate that from allergies? And again, allergies are generally runny nose, itchy eyes, and sneezing. But if you've got other issues like cough or fever, those aren't symptoms of allergy. And so that could be symptoms of COVID. And that's when you should think about seeking medical attention.
Thank you, Dr. Bloomberg. And going back to fears, you know, oftentimes because we've been inundated with so much information, people are afraid to go to the doctor. You know, any suggestions, any advice, Dr. Cherry, Dr. Cooper, Dr. Bloom, if you want to jump in on that. A lot of people have not been, you know, they'll just do home remedies just to avoid going to the doctor in fear that they may get COVID if they're just going for a doctor's visit.
Well, I'll jump in to start and just say that, you know, doctors' offices are following all the advice from the CDC. And when I'm in the hospital or an office says, I personally feel very safe because all the medical professionals around me are following the masking and distancing guidelines, and the patients are isolated appropriately. So I feel that hospitals and doctors' offices are very safe places. And the other thing is, you know, all hospital systems are increasing use of telemedicine and video visits. And so if you are nervous for that, opt for the video visit, and then you can do that on your couch at home.
Yeah, I second that. I think, you know, the expanding the telehealth has been huge for mental health, and it's really created enormous increase in access for so many patients who previously would have to commute, you know, an hour to get to the clinic. Patients with mobility issues would have to schedule a shuttle through their insurance company, and that shuttle would come late or not at all, and it'd take 3 hours out of their day to come to a clinic for an appointment. So I think really, I think the telehealth option that we now have so readily available for many specialties, especially psychiatry, has really done a lot to increase access for patients. So I think for patients who tend to have anxiety or fearful about going to the doctor's office, they can always pick up the phone, call their doctor, schedule a video visit first. And then based on that assessment, the doctor can recommend whether or not to come in for an in-person visit. Oftentimes, a lot of these problems can be solved over video and they don't require an in-person visit. And then if the patient has concerns about coming in for an in-person visit, the doctor can help, you know, remedy some of those fears and anxieties over video first, and then the patient can come in at a later point.
And just wanted to chime in, agree very much that I feel extremely safe in the healthcare setting. And so I would reassure patients that it is safe to come in, but also wanted to emphasize that we now know that because of the pandemic, our vaccination rates in both kids and adults is actually much lower than it has been in the past. And as we continue to open up, it'll be really important to remember to make sure you bring your kids in to get their routine childhood vaccines. And for those adults who are eligible for adult vaccines, like the pneumococcal vaccine, for example, or Shingrix or Tdap, it'll be really important to make sure you're still going to see your providers for all the routine preventive care services. We have been lucky this season with flu, extremely low rates. But again, as we continue to open up, we anticipate that next season will look a little bit different.
And from an adult standpoint, again, this has been a lost year for a lot of reasons. But I want to emphasize, you know, that yes, there's a small risk, but I agree with everybody else that in the healthcare setting, we've actually it's been incredibly rare to have a healthcare related transmission in the setting. Both the patient is masked, the provider is masked, There's a lot of screening that happens. There might be temperature taking, and the other provider might be, and often is, wearing a face shield. And so I think the risk of transmission is incredibly low. We also have to think of the risks of not going to the doctor, like missing things on screening, routine cancer screenings that we're missing, people that are not going to the doctor to check on their blood pressure or to get care for serious issues like chest pain or other things that are coming up. Those are definite risks that have been present as well for not going to the doctor or not seeing your provider. So yeah, I would just reassure people that it's really important to continue to get necessary care despite those fears and be reassured.
Thank you all. So Dr. Lee, I'm going to jump to you. You were the coming in. Everyone had an opportunity to introduce themselves and talk a little bit about their background. I'll give you that opportunity as well. And then once you do that, if you can talk a little bit, the question is, do teachers have to be have the immunization or the vaccination prior to us opening? And also, do our children need the immunization as well? And if you could speak a little bit to that.
Sure. So by way of background, I'm a pediatric infectious diseases physician at Stanford Children's Health. I also happen to serve on the U.S. Advisory Committee on Immunization Practices. And actually, I brought a few slides, if it's okay to share those. I'm happy to share on my screen, or if you prefer to share on yours, either is fine. But I want to, go ahead. Would you like me to share? Or
yes, you can go ahead and share.
Okay, let me just pull those up really quickly because there are just a few key points, and I do want to answer your question, but it'll be great if I can just use these slides to anchor in because I'm a very visual person. Are you able to see the slide deck?
Yes.
Okay. So just a few slides to share, but wanted to describe the process for vaccine development and recommendations. Wanted to highlight, and I think many now in the US recognize sort of what the typical process is, which is there are clinical trials that then move on to, oh, I apologize here. Let me just move this up into, that move into submission to the FDA for either a biologics licensing application or emergency use authorization. And then the Vaccines and Related Biologics Products Advisory Committee, or we call it VRBPAC, actually makes recommendations. This is a federal advisory committee that makes recommendations on FDA, for the FDA commissioner to approve or not the use of a vaccine from a regulatory standpoint. And actually VRBPAC is meeting tomorrow. It's an open meeting about the J&J or the Janssen vaccine. And they also previously met about Moderna and Pfizer. And then I sit on the Advisory Committee on Immunization Practices, and it's a federal advisory committee, again, that has open meetings. We're meeting this Sunday and Monday to deliberate about the Janssen J&J vaccine, as well as other clinical considerations. And it's an open meeting, and you're welcome to go to the website and listen in. But we provide our recommendations to the director of the CDC. This just describes a membership of the ACIP, which includes a variety of expertise, including 8 ex officio members and 33 liaison members around the table. Wanted to highlight specifically the incredible efficacy of the Pfizer-BioNTech and the Moderna vaccines. As many of you know, it's 94 to 95% effective after 2 doses. And what I just love about these 2 graphs is that it shows here that those who received placebo in the trials are in the blue and the purple here, and those who received the vaccines are in the orange down here. And you can just see that split happening early on, sort of between day 10 to 12, where it starts to split off. And those who did not receive the vaccine, who got the placebo, just continue to have an increased risk of infection compared to those who were vaccinated. So it just speaks to the incredible efficacy of this vaccine. I inserted this slide in part because I think one of the questions we get is about vaccine confidence, and wanted to just tell people to remind them that for those who haven't gotten their vaccines or who might have questions about vaccines, it's always great to have questions about vaccines, but it's also important to remember what to expect after vaccination. So local and systemic reactions are extremely common, such as pain and redness at the injection site. headache, fatigue, myalgias, fevers are common reactions, but they are very short-lived. It's only 1 to 3 days after vaccination that they occur. They only last for 1 to 2 days. It's more common after dose 2 than dose 1, more common in younger adults versus older adults. But again, this is what to expect after vaccination. And I equate it to sort of the book, What to Expect When You're Expecting, because we all know what to anticipate. For those of us who went through pregnancy, what are the symptoms that you have? It's the same thing after vaccination, but it's indicative of a good immune response. If you're having these symptoms, it's your body's immune response kicking in and responding to the vaccine, but you cannot get infection from the vaccine. It is not a live vaccine. And also wanted to just reassure people that there are various federal safety surveillance systems that are up and running and have been up and running since day one. I actually co-chair the Vaccine Safety Technical Subgroup for the ACIP for COVID-19 vaccines. And so we're looking at this data on a weekly basis as it's coming in regarding vaccine safety. The one that everyone's familiar with and that we have now enhanced sort of vigilance and monitoring for is around anaphylaxis, particularly amongst those with prior allergic reactions. To get to the question that the mayor asked, I just wanted to highlight that this is a very common model we use in healthcare safety, and it applies very much to thinking about schools and school vaccination and when is it safe to go back. I certainly believe that with protective measures that we've had in place and, in the healthcare system and in school systems, it is absolutely possible to get back to school. The main thing is to make sure that you've put into place all the layers or the mitigation strategies that are needed to protect ourselves and each other. And so that includes things like social distancing, masking, cleaning, hand washing, and now we have this beautiful layer of vaccines. The idea is that no layer is perfect in and of itself, but if you put all those layers together, or sometimes we call it a bundle in the healthcare setting, that bundles themselves actually are extremely efficacious in preventing infection in that you are layering all these strategies on top of each other. And so the chance of something breaking through one might happen, but it won't get through the second layer. But if it happens to get through the second layer, it may or may not get through the third layer, et cetera. And the nice thing about vaccines is with 2 doses, you have 95% protection right there. And that doesn't necessarily depend on, the behavior of others. But again, much like in healthcare delivery systems, ensuring that we have strong implementation plans in place and that we are highly reliable in how we implement each of these layers of protection, that is what protects us. And so it's us working together as a community and partnering with our colleagues in schools and healthcare delivery systems and public health and other parents and community members to make sure that we're all doing our best to protect each other. And I just wanted to kind of highlight that, Swiss cheese model is a simplistic version of all the things that in fact are happening or are recommended to happen as schools plan to open up. So I certainly think vaccines are going to be important, but I don't think that they're necessary. We have seen elementary schools open quite effectively. And actually there's some data from North Carolina to suggest that actually kids who went back to school actually were at lower risk for infection than those who were staying home. Again, with these mitigation measures in place, it is very much possible to reopen. I think the challenges are around, for example, the older kids, so high schools, in part because of the way that education is delivered, where it is far more challenging to stay in a single classroom as it is in elementary school than it is with high school. So just having to accommodate and making sure that those effective educational options are in place and maintaining cohorting is just more challenging. But I will leave you with one or maybe 2 key points. One is that I think of schools much like healthcare delivery systems when you're in pediatrics. So for us, we had a lot of worry from our workforce early on that it was that our workforce was going to be infected from the kids who were coming in and being seen. But in fact, we found that with all the mitigation and measures in place and without vaccines being available, that we had very little transmission in that setting as long as we adhered to all the layers of protection. In fact, the places where things broke down was often with our own colleagues. It was other adults where we were getting infected or our own communities. And in part, the biggest challenge is when people take off their masks when eating in small break rooms. And so we learned our lessons early and since then have been able to accommodate and make sure that we're having people eat and take breaks, but not expose each other by being unmasked. And then vaccines add that additional layer of protection. I anticipate vaccines will come soon for kids, but we're not there yet, but soon for the older teens, and I'm feeling personally optimistic about it. Thank you.
Thank you, Dr. Lee. So I'll bring all the doctors up. We're gonna open it up for questions. It's 5:34 and we wanna make sure that we get to the questions that are being presented. So one question is, with 100% remote learning since February 2019, my second grade daughter's self-confidence has been shaken and she has become increasingly frustrated. Simply put, online ED is not working well for her and many other young children. I'm worried about the long-term impact this might have and wonder if these impacts have been considered as we continue to delay reopening Albany schools. And I'll have you guys jump in. Go ahead,
I guess I'll
Dr.
start and say it's a really wonderful question. I mean, and the answer is we just don't know what the long-term impact will be on the mental health of our children from being quarantined for so long, from having so much remote learning, being away from their peers, not having that, the playing sports together in school, doing all the things together that they're used to doing. We just don't know, what that's going to do long-term for our children. And I think the studies that we have looked at so far, I mean, there does seem to be a real psychological impact on kids who are being quarantined for long periods of time. So I really think we need to take that into consideration when we think about how to open schools safely, how to maintain them once they're open, so children aren't kind of bouncing back and forth between remote learning and then being back in the classroom and having sort of this back and forth that can be, I think, a little destabilizing to their mental health. I think the other important thing is to really create a space and a dialogue with our children for them to feel comfortable talking about the feelings that they're having in response to the uncertainties of being at home, having these anxieties about remote learning. It's normal to feel a whole range of painful emotions in response to what we're going through. Kids can feel angry, they can be confused, upset. And there's a lot of uncertainty that, they don't fully understand, the nature of the virus and how it's spreading. And we have to explain to them in language that they can understand. But I think just having them know that they can come to their parents, other people in their life that they can trust and talk about their feelings, I think that's really going to pave the way forward for making sure our children are cared for as far as their mental well-being. And so again, creating that dialogue, creating that space where they feel safe to express themselves and talk about these things, I think is really important.
Thank you, Dr. Cooper. A question was also posed about the dental setting and as far as transmittal. Can anyone speak to that as far as, spreading the dental background and is the risk lower in a dental setting versus a medical setting?
I can jump in on that one. I've been to the dentist since this all started, once they reopened. And really the risk is more to the dentist and the dental hygienist than it is to the patient, because obviously the patient, when you're at the dentist, you can't be masking because they need to get into your mouth. And so they're at risk from transmission from you if you might be asymptomatic and carrying the virus. But they're all wearing N95 masks is what I've seen in the offices locally. And they're not they're protecting you against transmitting to you, and they're trying to protect themselves. They also have systems in place where in the past where they had done like the tooth polishing or the electric brushing and all, where they have these systems in place that will then do suctioning right away of that air so that the virus does not get aerosolized. So I think dentists who are following the routine guidelines, I think that these are very safe places to be and would not recommend putting off any needed dental visits.
I was just going to jump in and say, going to the dentist, or say brushing your teeth, taking care of your teeth and being proactive about that to prevent cavities, I think is analogous to trying to connect to a therapist, psychotherapist, being proactive about talking about your feelings and your mental health to prevent things from progressing to a cavity or a root canal or needing your tooth pulled. I think there's a lot of analogies that can be made between oral health care and then mental health care, really being proactive about keeping these things in check.
Thank you both. Next question, C. So visiting Solano today, I noted most of the outdoor diners were not wearing masks, regardless of whether they were eating or drinking. I also observed a homeless man with no mask, smoking and coughing within 6 feet of people. Is this a safe scenario? Don't all jump at once.
So again, I think it's hard to say by externally looking at what other people are doing. Certainly, I think that gathering, I think all of us have probably seen that with we want to kind of promote supporting our local businesses and restaurants, especially as they reopen outdoors. There are certain ways to do that are safer than others. Again, gathering with people within your household is safer than gathering with people outside of your household because if you're going to be in close proximity and taking off your mask. So it is generally recommended that both the servers and the staff, as well as the patrons, wear masks when they're not eating, and particularly they're coming, the server or the staff comes up to the patron. Overall, probably the risk is low for me and my daughter, for example, to be at a table together, 6 or more feet apart from other people outside, and talking to each other when we're not eating or drinking in between eating or drinking. It's probably lower risk than me being with my neighbor or somebody else. So I think that it's a little hard to tell the safety of what was observed without knowing kind of the exact situations there. Certainly, being within 6 feet of somebody and them coughing unmasked is not very, very safe, and you try to avoid that if possible.
Thank you, Dr. Cherry. Dr. Lee?
Yeah, I was just, I was thinking that, everyone has a different risk threshold or sort of risk tolerance. And so I think it really ends up being a personal question. I'll just tell you that I still do takeout. I don't sit there just because, even though we have kept a pretty tight household, I think of my elderly mother and making sure that we're minimizing risk to her. So I think, again, it's a very personal decision, but obviously the risk is not zero. The risk is low when you're outdoors, and you're 6 feet apart from other families. But it all just depends on sort of what your threshold is. And I will say I have, one kiddo, just to get back to the school question, who is in school, and I feel very comfortable. So whether it's the dentist's office or a restaurant or a grocery store or healthcare, wherever you go, I think it's really about if people are highly reliable on the mitigation measures, I feel very comfortable no matter what the setting. And I think when I see variability in the ability to implement those mitigation measures, I get nervous. So I kind of assess my environment and assess the risk, and then I make my decision from there.
And like we talked about before, it's a little bit about your ability you can control what you do, and you can't necessarily control what others do. So if you end up in a situation where you're around other people in proximity and you might be exposed to their risk behaviors, again, where you have no choice in the matter, right? And I think those are things you have to consider, being in situations where you control your environment and your exposure.
Yeah, I found it can be difficult too when you run into people, like say in your building or wherever you're living, or your neighbors, and they're not wearing a mask. And what do you do in the moment to potentially educate someone? And sometimes I try to start a conversation by saying something like, "Oh, I really like that invisible mask you're wearing there." So trying to come up with somewhat of a friendly way of like addressing the issue if you feel safe about having that conversation.
All right, thank you all for your answers. So here's another question. The vaccination. I've been vaccinated. Can I get COVID again? And if I do get COVID, it's twofold. Will I be able to spread it after being vaccinated?
I think this might be a great one for Dr. Lee, but for adult, again, from adults, we are essentially telling everybody, do not change any of your behaviors. based on your vaccination status or even on your prior infection status. There are lots of variables here. As the slide that Dr. Lee showed, that what we were looking at in those vaccine trials that showed really high efficacy of those vaccines, 94, 95%, was in how many people had symptoms of infection and then tested positive. We think that actually there's more and more data coming out that these vaccines also reduce transmission and reduce how many people have infection without symptoms. But it's not 100%, and it's, in the real world, it's never going to be 100%. And again, with certain variants, the UK variant, again, it still seems that the vaccine is very effective. With the other variants, it might be less so. And so it is possible to get COVID after getting vaccination, but it seems very unlikely, we hope, and it seems based on data right now that you would get severe COVID or be hospitalized or die from COVID. And that's the goal. Really, if we can prevent hospitalizations and death from COVID and make everyone who gets COVID have not only reduce the amount of people that get COVID, but make them get really mild COVID, then that's the goal. Kind of like with, these are much better actually than flu shots. Dr. Lee, go ahead.
I was just going to agree. I would say that the two things are, durability of immunity. So we're still early in the vaccination program, and we anticipate then the immune response has been tremendous. So we anticipate and hope that the durability of immunity will last beyond several months. But, there are studies ongoing to continue to measure the effectiveness. And then the variants. I think, as most folks have heard, Moderna actually has already developed a vaccine against one of the variants. And I anticipate, one of the questions I get often is, do you think it's going to be something like flu where we'll have to, consider a booster at some point in the future? It is entirely possible. I do worry about that. And then in terms of transmissibility, yes, we are protected against severe disease for sure. And I think that there is some good data emerging that there is also an impact on transmissibility, but not anywhere close to the protection against symptomatic or severe disease. So, again, I am vaccinated and I still wear my mask everywhere, and I'm pretty vigilant, again, because I know that I have family members that aren't fully protected yet, and I want to make sure that I keep everybody safe.
I think one other important thing is we see quite a few people actually that get an infection between the first and second vaccine. So to make sure you understand, I think someone asked, do you need to get the second vaccine? And yes, we do recommend that everyone gets the second vaccine. The numbers are I think they're kind of like in kind of 70 to 80-ish percentage efficacy after one injection, and then up to the 94, 95% was really with the two injections. And again, we don't know how long immunity with just one injection would last. So we really recommend both doses. And remembering that after the first dose, you're not maximally protected as much as you would be a couple weeks after your second dose. So to continue to be really vigilant. I see a lot of people that say, well, I've gotten my vaccine, so I don't have to worry so much anymore. But not only should you continue to be careful after the second vaccine, but really remember that it's a couple weeks after the second vaccine that is where you get start getting the most immunity.
I also just wanted to add that, if the vaccines are reducing the severity of COVID, if you do contract the virus, there have been a lot of studies showing that, when the body's in an inflammatory state or, a lot of inflammation can be linked to developing psychiatric disorders. So if we can reduce the severity of inflammation of people who contract COVID by getting the vaccination, we could in turn reduce the onset and development of psychiatric disorders, which I think is a really, really important point.
I think, Mary Gary, you're muted.
Dr. Blumberg, did you want to add anything? No? Okay. All right, we'll go on. Okay, we'll go to the next question, please. So this one, I'll ask this one first. Have cases of COVID gone down across the US, no matter whether states are requiring masks and physical distancing or not? Or are the states with stricter mandates doing better? One part of the question. The second is there a relationship between local and statewide protocols for COVID?
I can start with that one. There's clear evidence that these masking mandates work. And in fact, a few months ago, the CDC published the experience in Kansas, where the governor issued an executive order requiring wearing masks in public spaces. It was effective July 3rd, but it had the option that the counties could opt out if they wanted to. And it was clear that for those counties that mandated masking, there was a decrease in transmission and the decrease in the number of cases. And in those counties that opted out, there was an increase in number of cases. And we've got examples from Europe also, that the countries in Europe that had more stringent policies in place, that they saved thousands of lives by implementing those earlier. So these lockdowns, they work. Of course, they come with a cost, but they save lives, they work, they decrease the transmission, they decrease cases, and they do decrease deaths also. There's no question.
I 100% agree. And I know that there's comparisons made across state lines, but it's you don't really know the counterfactual in terms of, what the agree 100% that the death rate and the hospitalization rate would only be higher if we didn't have stringent measures get put into place. That surge really, to me, was all about travel around the holidays, despite all the warnings. And I think people really just wanted to have a sense of connection with family, which I can completely sympathize with. Absolutely miss my family and want to see them, but I want to see them when it's safe to be able to do so. I think I'll pause. There was one other thing I was going to say, but now I've lost it. Sorry.
Okay, no worries. All right, we'll move on to the next question. This question is for Dr. Cooper. Dr. Cooper, the mental health data you shared is devastating. In your opinion, will keeping the schools closed this year create more risks than benefits to the health of our children?
Yeah, I agree. I think that, prolonging the opening of schools will certainly create more mental health problems for our children. And, as the other physicians here have shared, we can open schools safely if we do it in a very thoughtful manner. Children don't seem to be getting the kinds of severe COVID disease that we see in older adults. So I think as much as we can and as safely as we can, reopening schools and allowing for in-person learning will definitely keep the mental health conditions from rising over time. That being said, we do have to keep thinking about transmission and the safety of teachers and everyone else who work at the schools. So we have to do it thoughtfully and we have to do it carefully as far as reopening schools and doing it in a safe manner for everyone involved. But I do think having children get back to in-person learning will be really beneficial for their mental well-being. Absolutely.
All right, thank you. And I'll add on to that. The next question is support groups. Do you know of any support groups that can help our children via Zoom or outside when the weather starts getting warm? You can speak to that.
Yeah, as I was saying earlier, there's many options now available for online, virtual, telehealth, telepsychiatry options via Zoom. And I'd be happy to share some of these maybe with you, Mayor, like afterwards, and maybe we can distribute some of these resources. But depending on where you're living, there's local, city, statewide communities available for therapy groups. It really depends like where you're living, what your insurance coverage is, but there's plenty of options for people. And there's some good websites where you can put in your location, the kind of group you're looking for, and then they'll have plenty of links for signing up for groups. And, people are getting creative with psychotherapy. I know several therapists are doing outdoor walks in nature with their patients 6 feet apart and doing therapy that way, which is really wonderful to see. So I think having options like that, doing more like creative out of the box things like outdoor therapy is really incredible to see. But I also think the virtual Zoom therapy is very effective as well. And there's plenty of opportunities for that.
Thank you, Dr. Cooper. So our next question is, how have so many other school districts in the Bay Area, state and country and world as a whole reopened schools without vaccinations? First part, what happened after reopening those districts?
I can just take a stab at that. I don't know the individual data from those districts, but I can say that in general, the experience when schools have been reopened is there's been very little transmission. When there have been cases of transmission, what's been found is that the recommendations for masking and social distancing have not been followed, and that's led to clusters of infection. So we need to follow the guidance, the distancing and the masking. As Dr. Lee mentioned, that's especially true when eating. And so when people eat lunch together, when the teachers or administrators eat lunch together and they have their masks off, that creates the opportunity for transmission. So it does make it difficult to follow those guidelines. Different schools and school districts have different resources available. Distancing may not be feasible in all classrooms because of the physical layout. Personally, I don't think there's anything magic about 6 feet. In the US, we've chosen 6 feet. We know that if you're 3 feet away, that decreases transmission by 90%. Adding an additional 3 feet makes it 95% decrease. Some European countries choose 4.5 feet as the rule that they're following. So there's nothing magic about that. I would be happy if the students were separated by 3 or 4.5 feet if they can't separate by 6 feet. And I think that another option is for schools to go back to in-person learning for like half days, so that half the class is in the morning, half the class is in the afternoon, and then they could further spread out. But even when schools do reopen, there's going to be some teachers and administrators, because of their risk assessment or because of their individual circumstances, that they're at increased risk for severe disease, or their household contacts are, or they live in extended families. And the same with students that will want to continue with distance learning. So, ideally school districts will be able to reopen for in-person learning, and for those who want to opt out, they'll still have that option so that they won't be forced to go back into school, both for teachers, administrators, and for students and families.
Thank you, Dr. Bloomberg. Dr. Lee, did you want to chime in?
Well, I finally remembered the last point I was going to make when Dr. Bloomberg spoke. So let me get back to that, and then I'll try to see if I can just add on anything.
Sounds good.
100% agree. One is that, in terms of thinking about developing immunity or herd immunity, there are 2 ways, as was mentioned previously, to obtain herd or get to herd immunity, and that would be either getting infected or getting the vaccine. And to me, vaccination is just a far safer way to develop an immune response compared to getting infected. And as Dr. Cooper mentioned, there's all the sort of longer term consequences of infection itself, whereas developing immunity from vaccination, seems to be the way to go. So I think that when we're comparing the experiences in different states or different countries, it's and making assumptions about sort of what is the impact of this measure or that. I think also understanding that when there's been less attention to masking and social distancing and all the other mitigations in place, it means probably a large proportion of that population was infected. And in fact, again, I think for most of us, we would rather get vaccinated than get the infection. With regard to the question about schools, again, I like to just share my anecdotal experiences. There's definitely the data that shows that when schools have opened, it's been far more common for people, for the infections to be introduced by other teachers and staff than it is for the kids to be introducing infection. And I found the same in our pediatric healthcare settings. It's been far more common for that to happen from each other, the adults, than it is from our kids. And my own personal experiences, I've had one daughter back in school since last June, and it's just been terrific, in part because the school has maintained all the mitigation strategies in place, and it's been smooth sailing. And we've been very fortunate that she's been able to go back. I do have one that hasn't been able to go back, and she is very excited to receive a vaccine and go back to school.
Very good. Thank you both, Dr. Bloomberg and Dr. Lee. So here's a question. I guess they just want you to address this. It says, can someone please address how to mitigate against the stresses and anxieties experienced by teachers and students who return to in-person learning and are struggling to adapt to all of the additional protocols? Many people seem to think that reopening schools mean a return to pre-COVID conditions. However, teachers who are already returned in in-person teaching are reporting high student and teacher stress levels, anxiety attacks, and breakdowns when they have to learn how to teach in highly rigid environments with masks, social distancing, and other obstacles to effective communication socialization.
I'll start off with that and then defer to Dr. Cooper about the anxiety issue, but I can say this about children. Children are extraordinarily resilient and they can mask, they can follow directions, and studies have shown that when schools open with masking mandates, that more than 90% of children at any one time follow those recommendations. So this can be done. I've got no question about that. It's amazing. Children want to return to school, and I never thought I would be saying those words, because children pre-pandemic were complaining about school all the time, but they want to return to school. And what I'm hearing about students who are returning to school is that they're happy about it, and it decreases their stress level overall. And they are following the guidelines because they do want to stay in school. But I'll defer to Dr. Cooper about the anxiety issues.
Yeah, I think I would, emphasize that some degree of anxiety is normal with these types of transitions, and to expect otherwise, I think, would be impossible. So again, trying to create that space where people can feel these emotions, they can talk about them, maybe budgeting time during the day, even 5 or 10 minutes, where teacher and his or her students, they can talk about how they're feeling about being back in the classroom, what it's like with the transition, wearing masks, following these new protocols. How are they doing? Creating that space and time for both teachers and students to talk about these things, I think is really important, to have that kind of dialogue about it. And then to understand that anxiety usually gets better over time, right? As people get readjusted to the new protocols, being back in the classroom, anxiety in most cases, I think, will improve. It's just allowing time for it to happen, creating space to talk about it. For individual students and teachers where the anxiety is worsening, or it's keeping them up at night, affecting their appetites, getting in the way of their daily functioning, that's when you need to really think about finding a psychotherapist, finding some groups to be a part of to talk about these things more at length, seeing a psychiatrist, maybe even considering medications. But I think in most cases, it's, again, very normal to have these types of anxieties and stressors with transitions. So just being able to talk about it more, I think, would be really helpful.
Yeah, and I'll just say, in terms of caring for COVID patients, and I know my colleagues on this call have cared for COVID patients, I think in the beginning, in last March, there was a lot of anxiety, even amongst our healthcare workforce, just in, making sure that we were safe in caring for these patients. And then as time has gone on, I think, I feel 100% safe caring for patients who have COVID. But it becomes this adjustment where you, number one, have clear and consistent education about sort of what is safe and what you can do to mitigate risk. The second thing I think that's always helpful also is just to have the ability to have escalation strategies within your environment. So knowing who to go to and how to get answers to your questions. I think the most unsettling thing is feeling like that there's uncertainty or that you can't get an answer to your question. And I find that when we're able to be responsive as a system, and that there's, good leadership in place that is able to help people get through this change in the way we start to think about how we return to school, care for COVID patients, whatever it may be, that it becomes normal over time, but it is a period of change that you just have to get through. And I'm glad Dr. Cooper's on the phone, but it is a process, and everyone will get there, but we have to be able to just start the process. If we don't start the process, we'll never get there.
Yeah,
We haven't talked about, go ahead, Dr. Chair.
No, I was going to say the same thing about teachers. I think we talked a lot about students, and I completely agree. They adjust. As I have a daughter that's in high school, and I have a daughter that's in second grade. and the daughter in second grade is back in school, and she wears her mask all the time, even when I tell her to take it off. She's just used to wearing it now, like at home and in the car. And my daughter that's in high school and looking at has a lot of stress, and I'm sure there'll be a lot of stress about returning because it's another transition. And people that are introverted, I think, also are going to have a more difficult time returning to kind of normal or somewhat normal social interactions. But I agree that teachers just need to feel supported and know that their school and their leadership has a plan, contingency plans, what will happen if there is an in-school transmission in that rare situation. But again, having experienced that transition in my daughter's school, I think that with all those safety measures in place, everyone will kind of be surprised and kind of adjust to the low risk that they actually will find themselves to have at school with a good plan in place.
I was going to say,
and as we continue to go ahead.
Sorry, I was going to say, it's going to be a good opportunity to, if we could find the funding for it, to embed more counselors and therapists within school systems so they can be there. Students can drop in, talk to them, teachers can as well. Maybe these therapists can organize group therapy sessions for the students and teachers periodically throughout the school year. So I know schools are strapped for funding, but if we can figure out a way to embed more mental health within the system itself, especially during these transition periods, I think that could really help.
I agree.
That would be great. And I just think, I think we all think schools are just so important for our children, for our families, for our communities. And really, they should be the last institutions in our communities to close, and they should be the first to reopen. They should be prioritized for reopen. I understand other businesses have been very much impacted by this, but we really need to concentrate and do everything we can to get the schools open.
Thank you all for the conversation and answering and addressing the needs of our community. We've talked a lot about, our children, our educators, but we haven't spoke much about our veterans and our seniors that are dealing with isolation. Definitely when they come out into our community, how are they're able to interact outside of fear? They're vulnerable, right? They've been vaccinated or not, but you have our community coming together. Let's talk a little bit more about that and some ways you can help us as we start reopening our businesses and then opening our schools. How do we address the needs of our seniors and veterans?
So, I think that this has been just like our children, this has been a major issue. And I think early on, we saw a lot of older adults being infected and being really impacted by COVID. And then kind of towards the summer, we were not seeing that at all. And it's because I think that a lot of our older adults started taking this very seriously, potentially, a lot more so than younger people, and being very careful and isolating at home. And in fact, when I talk to many of my patients, they're really adhering to public health guidance. But it can result in not only social isolation, but also in missed healthcare opportunities and kind of not seeking out the care that they need. I think I actually just saw a study a couple of days ago showing that even non-professionals kind of reaching out to older isolated adults can have a benefit. And so I'd also actually love to hear what Dr. Cooper says, because I think that any amount of interaction we can have, through video or virtual settings. And again, this is also a situation where many people might not have access to technology and video type of technology, but anything we can do to reach out to seniors and people that are isolated is very much needed. Because I think that they have, because of the seriousness of this in the older population, people over the age of 65 are really disproportionately affected when it comes to hospitalization and death from COVID. So as a result, I think they've all been being very careful. And again, trying to reincorporate them. I think that's also why it's been so important to vaccinate that group first. And we've been making lots of efforts. I think that most counties should now be at 65 and older, I believe, for vaccinations, and we'll soon be moving to the younger age cohort, particularly high risk younger cohorts. And so it's really important to get these older adults immunized and really encourage immunization to try to start allowing them to interact with society more.
And I would say this too, that these vaccination efforts, they're working. I mean, what we're seeing is that the patients who are in assisted living and nursing home and extended care facilities, they were prioritized. And the death rate has dropped dramatically in that group, which correlates with the vaccination efforts. So we hope as we gain more experience with vaccine and higher levels of vaccination within these communities, that they won't need to be isolated as much any longer, and that maybe groups of vaccinated individuals can then start visiting these facilities. So as we gain more experience, we hope to gain more guidance from the Centers for Disease Control and from the California Department of Public Health so that these things can start happening and they are less isolated.
Yeah, I think this is one of these situations that require creative solutions. And with the nursing homes I've been working in, there's been a huge push to implement more technology, iPads for video sessions, for not only for therapists to do psychotherapy with residents of nursing homes and long-term care facilities, but for these residents to have video calls from family members that live across the country who normally wouldn't be able to come visit them very easily. They can see them over video. And I've just received a lot of positive feedback from residents at nursing homes feeling, although on one hand, isolated because they can't physically visit family that are local as much as they would before the pandemic, they're now getting more video calls and therapy sessions in ways that they hadn't been before COVID. So again, I think this highlights silver lining of the pandemic is it really has expanded access to good mental health treatment. And we're working on coming up with creative ways of reaching people who normally didn't have access to therapy before, or even couldn't visit their family virtually in ways that they can now. So I do have hope with this.
All right, we'll answer our last two questions. If the patient before me at my doctor's office takes off their mask in the exam room, should the air be purified before I'm seen by the doctor? Or should I worry about that? My GP doesn't have windows or ventilation in the exam room.
I'll try and take that one. I don't think there's a perfect answer to it, but I would just say, we do ask all of our patients and family members when they come to see us to wear a mask if they're able to. And so I would say I wouldn't personally worry about it. In general, I would say most healthcare facilities have already put into place, again, mitigation strategies, especially related to the space and the physical layout, as well as air handling already. I know that we've, I now know how many air exchanges there are in every room in our entire healthcare system. And I did not know that before COVID. So I would say I would make sure the most important thing is that you get the care that you need, whether it be virtual or in person, and ensuring that you're taking good care of yourself.
And remember that this is primarily spread by respiratory droplets, which are heavy. And so they end up falling to the ground and then they're harmless. So they don't stay lingering in the air. If there is a procedure in that room that generates an aerosol, then that room will be closed until that can be removed, till that possibly infected air can be removed. So those are the policies that healthcare providers are following.
Yeah, I would just note that even though you might not see ventilation, there are air. We are aware of air exchanges in the room, and there is ventilation in the room. And most usual activities, like if I were to pull down someone's mask to take a look at their mouth or throat, that type of activity would not create aerosols.
Okay, and our final question, I have one more question before our final question. My daughter asked this question. She's been working since COVID, since the first reopen, and two of her employees had contracted COVID. They were sent home, they cleaned everything out. Her question is, why didn't they shut the organization down for 14 days? Because they could have been exposed, but it was simply a 2-day close, and then they were back to work as usual.
My assumption is that there was contact tracing for those individuals, and typically our contact tracing processes identify who's at risk. And that happens in school settings and healthcare settings and community settings. And every time there is a positive, you do not need to shut down the whole building. What you need to do is figure out who was exposed, and that's why the cohorting is so effective, because it really limits how much mixing is happening and mitigates that exposure. And then those who are exposed are asked to, quarantine if they didn't have sufficient PPE available. But again, wearing all of those layers of protection or implementing all those layers of protection protect all of us. And so, in fact, exposure doesn't happen just because somebody in the building had a positive test. Exposure happens when we don't have those mitigation measures in place, and you are, not wearing a mask, eating with a colleague who is COVID positive. That's where the risk happens. So again, I would, just send us back to the implementation plan, and just a robust implementation plan will help all of us.
All right, well, we're going to get ready to wrap things up. But before we do, I have you, doctors, this wealth of information, very informative. But we want to have some takeaways. What can you advise our community as we're starting to reopen our businesses, as we're still trying to navigate reopening our schools? Are there some action items or things that we could do better to make sure that our community is safe? We have these variances coming. We want to make sure that we keep everything under control. You speak about masking, the vaccinations that are rolling out. But what else, if there's anything that we could do to keep our community safe?
Well, I would just say that, we are in a good time now. We have decreasing cases. There are vaccines available. We expect to have more vaccines available. So we expect to have improved access to vaccines. So the end is in sight for this pandemic, I think. And we just need to remain vigilant by continuing to mask, continuing to social distance, to decrease the number of cases until we can get enough vaccine into people's arms that we can create that level of immunity within our communities. So I know it's been a long time, but we need to continue doing what we've been doing and following the public health guidance.
I think I would agree. I think that, again, control what you can control, which is your own, personal public, adherence to public health recommendations. And remember that, there are trade-offs, and we need to keep things balanced. People talk about sometimes, how can I be sure that my child's school will have 0 infections? And that's not the intent, actually. The intent, we know that there are clear risks of not going back to school. There are not going to be necessarily 0 infections in school, but the goal is if someone brings in an infection, that it won't spread. And so I think managing our expectations, doing what we can to protect ourselves, and understanding kind of all the things that we've talked about today that might go into weighing the risks or benefits of various things, and your behaviors, and to again, mask, just above all, mask, and I really encourage vaccination if that's something that you're eligible for.
I'll finish the ID trio so Dr. Cooper can go last. Again, I would say as soon as you get the chance, go get a vaccine. I definitely think that is the number one piece of advice I would have. The second would be to just continue to, educate yourselves, educate your community, make sure you're going to credible sources of information. I often, refer people, especially with questions about vaccines and even, school reopening. The CDC website is a great resource. The CDPH website is a great resource. There are organizations like the AAFP, the American Academy of Family Practice, and the AAP, and other organizations that also have good, sound scientific data available. Hope that with that information that we can start to make this change together. Change is going to be difficult. It won't be easy, but I agree 100% with Dr. Bloomberg's comments. We need to be able to reopen schools. To not only, importantly, to educate all of our children and ensure that there is educational equity that is implemented, because I do think the disparities have grown wide during the past year. So the closer we can get to that, the more comfortable we can all get together, the better our communities, our children, and our families will be. Thank you.
And yeah, I think I would just end with 2 points. One about communication. I think so much of this goes back to thinking about how we communicate with each other, how we express what we're feeling, listening to others when they express their own emotions, recognizing that there's going to be anxiety that comes up through all these changes, through all these transitions, but this too shall pass. The anxiety will go away, it'll get better, there'll be a new anxiety. As long as we continue to acknowledge what we're feeling, what we're experiencing, what our children are going through, our seniors, everyone in our communities, just keeping that dialogue open about what we're experiencing, knowing that we're in this together, we're connected, we're not separate. I think that will really help us get through this, is just keeping open communication with each other. And that's really one of the fundamental principles of psychotherapy, is communicating with another person, really understanding what they're going through, where they are in their lives, and being open to trying to understand them. And then the second point would be creating 3 to 5 minutes a day of gratitude, just recognizing what we have to be thankful for. It could be something very small, like this morning, just thankful to have a cup of coffee from Pete's. And just, I don't know, acknowledging that, just finding a couple things, small things each morning to be thankful for can go a long way to relieving stress, depression, and anxiety. So I think creating that kind of space for gratitude is really important as well.
Well said, Dr. Cooper. Well, Dr. Cherry, Dr. Blumberg, Dr. Lee, and Dr. Cooper, I am grateful and thankful that you have allowed this space to come into our homes and our community and just share your expertise on the misinformation that has been given, but also just giving us things to reflect upon as we move forward, as we start reopening. And although we may have fears, and like Dr. Cooper said, the anxiety will come and go, we still know that, like you said, this too shall pass. And with that said, I want to thank the staff. I want to thank Vice Mayor Jordan for jumping on, our council members, and our residents for participating in what we call our first community conversations. With that said, you have a good evening. Thank you.
Thank you.